gaps. We're extension of the PCP or their specialist or the ER, whatever we need to do, that we're able to go in and visit that patient in their home, identify gaps in healthcare, and helping that patient manage those gaps and give them the resources that are available to manage those gaps in their healthcare.
This CEO update is about our mobile integrated healthcare program. It's a new program at CMH that started in July of 2023. It fits in our strategic plan to provide the safest and highest quality healthcare, and also to deliver quality healthcare through increasing our participation in population health programs. The program was made possible because of approximately $1.8 million in grant funding, and that funding provides for vehicles, personnel, and equipment to be able to carry out the mission of the program.
I would explain MIH as being community paramedics working as an extension of primary care providers, going out to patients and bringing that healthcare to them. It's definitely a great service for high-risk patients. We're able to provide additional support and bring healthcare to them.
I see it as a time when, back in the day, when doctors made house calls. That's kind of what we're doing. We're going and seeing that patient in their home, whether it's they don't have the transportation available to get to the doctor, they can't afford to get to the doctor. There's been gaps where they've had arrangements made and those transportation services have not came and seen the patient. So we're able to get into the house and actually lay eyes on the patient, evaluate the house and see if there's other needs that they need. Maybe help with utilities, help with food, these things that all affect their health care.
It is a short-term program, so that's one way it is different from home health. We're not taking the place of home health. If they get established with home health, we step back. And we have had several patients where that was our goal, was to just make sure they get established with home health, physical therapy, something in the home to make them better, to where once we're done, they're either in someone else's good hands or they're in a better place in life to where they're taking care of themselves better or have the resources they need to do that.
One of the key aspects of our mobile integrated health program is that it's integrated throughout our system. We have multiple departments that are working together with our community paramedics to make sure that patients get what they need in the home environment. Our physicians and primary care team, our care management team, our pharmacy team, they all work together to make sure that we're coordinated in the care we provide. Participation from our primary care providers is essential to the success of the program, and they've demonstrated that they've seen what a difference it makes in patients' lives. Patients that aren't able to come into the clinic are able to get care immediately, and they're able to link up with those patients through telemedicine services. So we really appreciate the involvement of primary care in the program.
So it's a collaborative effort. So mobile integrated health is not really its own separate entity, but kind of the culmination of all different aspects kind of coming together. So we're not out seeing patients on our own. We're literally doing it under what their physician wants. So there's a lot of communication with their personal care team. Transitional care management's involved, community resource specialists. There's all kinds of different departments of the hospital that are actually helping determine and kind of shape the course of what this program does. This is really a good transition in the patient's environment between the physician and their patient. So it's a way for that patient to have needs met in their own environment.
In the first 7 months, we saw 56 patients and had 233 patient visits, but recently we've seen an increase in the number of patients we've been able to serve. In the end, it's really not about the numbers, it's about making a difference in patients' lives, and we're seeing a difference being made in patients' lives because of the MIH program.
One specific example that comes to mind is a patient that was homebound. She was pretty much stuck in her living room due to her wheelchair not fitting through her house. MIH was able to go out and kind of set her up with a virtual visit with our primary care provider and help with that. And we were able to get her a walker.
I just had actually a patient last week. It's one of the patients I'm seeing for some wound care issues. And one of the comments he made to me on that visit before I left was he truly appreciated feeling like the hospital care, not just about if you're there because you're sick and needing something, but the help that we're giving now. The benefit I'm seeing from this on a community-wide scale is just fantastic.
I'm really thrilled about the stories of how the MIH program is making such a difference in patients' lives. For more information about the program, check out our spring 2024 issue of Vitality, where you'll learn more about this innovative service that we provide here at CMH.